The traditional March mnemonic, massive hemorrhage, airway, respiration, largely the search for tension pneumothorax, circulation and hypothermia prevention and management, was designed, scripted, based on that Vietnam WDMET data. It was providing a mnemonic of what killed people. 10% bled to death out of arms and legs, 1% airway occlusion, 10% tension pneumothorax. However, in 2025, the Committee for Tactical Combat Casualty Care asked the question, is this version of the mnemonic now outdated? Again, wide availability of pre-hospital blood. And there were discussions of going to match massive hemorrhage, airway, transfusion. Let's give somebody blood before we start worrying about things like tension pneumothorax, chest, and hypothermia prevention and management. There were some people who wanted to stay with the traditional March, I guess, mnemonic, but change what it meant. So massive hemorrhage, airway resuscitation, which I'll come back to, chest and hypothermia prevention and management. One of the issues I have with this version of March is if you have blood, you're transfusing a patient. If you have IV fluid, you might be resuscitating your hypotensive trauma patient, but you're giving them crystalloids. You're giving them fluid that does not carry oxygen, does not have clotting factors, and may just be diluting their clotting factors. Even if you resuscitate hypotensive trauma patients with hypotensive resuscitation to a systolic blood pressure of 70, which is a little more than half normal, or a mean arterial pressure of 50, pretty low, IV fluid is not blood. So I really do prefer the match concept here. If we want to support this idea that maybe we need a transfusion or resuscitation arm above chest injuries, Brian Eastridge published a study of 4,596 global war on terror trauma patients' deaths and found 14.6% died from bleeding into their torso. Furthermore, there's been some review of global war on terror deaths to suggest that quite possibly tension pneumothorax only occurred in 1% of those fatalities. All of this is starting to make pretty robust suggestion that maybe this 3 to 10% could be as low as 1. If you have blood, you can do something with this. And this concept of match makes a lot of sense. The Ranger Regiment has codified this in the statement that a needle in the arm, i.e. give someone blood before you put a needle into their chest. And again, we'll talk more about tension pneumothorax, but in general, it takes at least 20 minutes for a casualty to develop this kind of life-threatening chest injury. So if you're with a casualty in less than 20 minutes and they're in shock, it's more likely to be from blood loss than it is from tension pneumothorax.